Hi everyone, my name is Adam Boss. I'm with the Office of Health Services Research at the West Virginia University School of Public Health. This is learning session number 5 for our PCDC Learning Collaborative. This session focuses specifically on doing CDEMS analytics and some custom reporting within the CDEMS using the Create a Report tool. And as always, I wanted to acknowledge and thank the Pacific Chronic Disease Council. We're very appreciative and thankful to be part of this collaborative, and I also wanted to acknowledge Gwen Hosey for her leadership and ability to always be a fantastic partner. So a little bit about our office, the Office of Health Services Research. Our mission is really to help improve the delivery of health care and ultimately help improve health outcomes. No matter what the effort or the project that we're involved in, we really focus on data-oriented work. And ultimately, we're wanting to make sure that our primary care partners have good, solid, quality, reliable data that they can use for patient care and population health. And we help to make sure that there's a continuum of learning. So whether it's a patient registry, or an electronic health record, or a practice management system, whatever that data source might be, we like to turn that data into ultimately knowledge that can be acted on. So moving through that process of going from data to knowledge to action. So a few notes that I wanted to mention about any sort of data analysis, some fundamentals about that. What we recommend is taking time to think through what it is that you really want to have in the end. So start with that end in mind. So what's the question, or what are the questions, and how are we going to go about answering those questions? From our experience, the essentials to that, first and foremost, would be your partners. So who are those people that you want to work with, need to work with, and really need to have on your side to make those answers possible? And of course, data, and oftentimes data sharing across partners is very essential. And really a shared sense of what your goals are, what your vision is, what that shared mission is across partners. Those are some of the fundamental things that we go through time and time again when really doing any set of more complex analysis. So in terms of what data are needed, so questions to think about: where are those data stored? At times the data will be all at your clinic. Maybe that's not always the case. Maybe some of the questions that you have in mind require data across multiple locations. And also, are the data that you need collected already? If so, where? Or do you need to do primary data collection for some other reason based on the question that you happen to have? So depending on how complex that question is, maybe you will need more than one source of data. Those sorts of questions are good to talk through with yourself, talk through with your partners. And if you do need more than one set of data, can those sets be combined? So if we're talking about clinical data, do you have, for example, a unique identifier for each person that can be combined across data sets? Now, the analyses that you have in mind may or may not get that complicated, but they are good questions to think through regardless of the level of analysis that you have planned. So for this learning session, we're going to focus on something much more simple, much more straightforward that you can do with your own data in your own clinic. So within CDEMS, you may or may not have used this already, but there's what's called the Create a Report tool. This is within the reporting app. This is located at the very bottom of the list of reports within the summary level reports in CDEMS. And everything that I go through here in slides will jump out of this presentation. We'll go to CDEMS and we'll go through all of these steps together. One thing I wanted to mention about the Create a Report tool is that all reports are queued on or based on the health condition. So the first thing that we'll do in the top left of this form is choose the condition or conditions that we want to have our summary report based on. After we do that, we'll have a list of data selections that come up that are associated specifically with those health conditions. And the nice thing about this report is that it can be as concise or as extensive as we need, so we can pare it down or ramp it up to exactly what it is that we want to have displayed. My recommendation is that you start smaller. So a nice, and tonight what we'll do, we'll build a report for type 2 diabetes, and we'll throw in some of the basic demographics that we might need in patient counts. We'll look at blood pressures, some comorbid conditions, and just the HbA1c values, and look at who's above or below threshold. So that in itself is enough for one good, useful summary report. And again, I do recommend that these reports start smaller. Conversations are often better that way. They're more focused, and you can have only the data that you need for that discussion on that sheet of paper so that the focus doesn't go off track. This is an example of the summary report that we'll create, and you'll see as we do it, it's really easy to do. What I've highlighted on this report is the of the 2 patients in the sample or the demo data set that I have. One of them has an HbA1c, and of that one person, their result is less than 9, which is ideal. But what we can do for that one person who doesn't have one, we can find out who they are, and then we can generate a letter for that person and have that letter sent to them. So this is the patient list report that we'll also look at. So we'll generate a list of all patients with type 2 diabetes without an HbA1c in the specified time period. And this is a look at what that report will look like. You'll have the chart number listed, the last name, first name, and the condition, and some other variables also, specifically for patients that meet that criteria. And we'll go a step further and look at the reminder letters and call lists so we can generate a letter for all patients that need that HbA1c. So we can start on a larger global level, look at a summary report about diabetes. We can move into a patient level report that shows specifically who in that report needs attention, and then we can do some actionable steps and generate a reminder letter for that patient that needs that A1C or the patients that need that HbA1c. This is a sample view of what that letter will look like. We'd be glad to work with you and your care team to customize these letters and have them read exactly as you would like, have your own logo, contact information included. And it's a standing offer from our office to you all that we want to be the best support that we can. So anytime that you have questions or would like support, please don't hesitate to reach out, and we'll be glad to work with you. We've been doing a fair amount of work over the web, conversations over Skype. That connectivity is working quite nicely, so we'd be glad to do that with you anytime that you need. And after we look at the Create a Report tool, we'll look at something more complex. This is a non-communicable disease NCD collaborative diabetes measures and goals report for 2017 that was shared with us recently. And you can see on this report there's a lot of measures, but not only are there a lot of measures, the interesting complicated thing is that this summary report asks for patients stratified by different age categories or age ranges. And this is something that the Create a Report tool will not do very well for you. So what I wanted to show you is a response to that more complicated report is this. So this is an indication of more complex reporting within CDEMS. So this is a summary level report that is hard-coded into the registry. We built this in specifically for the use by PCDC, and we're glad to do these types of custom reports as you need them. But in this case, we've built a multiple series of queries where we can have those multiple age ranges or multiple conditions, comorbid conditions, etc., all built into one report. Again, this is not something that the Create a Report tool will do very well, but we can build custom reports and queries into the registry and do it another way. So this is our contact information. I'm Adam Baus. My phone number, email is there, and we're also very accessible over Skype. But anytime that you'd like to contact us, send an email, and we'll get back with you quickly, and we'll be glad to coordinate whatever level of support you happen to need. All right, with that said, I'll go ahead and jump out of this presentation, and we will step over to the reporting app. Okay, so the first thing we'll do is take a look at the Create a Report wizard within the list of summary reports. So when you first open up the registry, you see you've got the report type box here, and summary level is the default choice. So we'll scroll all the way to the bottom, and you see this Create a Report. So click on that and click Run. And this is the same form that we were looking at in the PowerPoint slides. So the first thing we'll do in the top left box, we'll choose type 2 diabetes. And you see right now all of these selections boxes are blank, but I'll add type 2 diabetes, and now they're populated. So you can see in your registry all of the variables that are associated specifically with type 2. They get brought in. So we'll ask for a few basic things and keep the report nice and small. So we'd like to know how many patients we have with diabetes, how many haven't come in, how many have, and we can ask how many have had a blood pressure. And not only that, we can ask of those that have had a blood pressure, how many are above or below a certain threshold. So we can ask how many are less than or equal to 140/90, which I believe is the criteria that the PCDC has been interested in doing. So we can ask for both the systolic and the diastolic to be below, less than or equal to 140/90. So you see now we're asking for how many have a BP and how many have a BP at that goal. And we'd like to know how many have type 2, how many have hypertension, maybe how many have hyperlipidemia. We'll keep it small. And let's see, we'll look at the HbA1c. So how many have had one, how many have had that test, and then in this other selections box, we'll ask of those that have had the test, how many are below whatever value we want. So I'll type in 9. So how many have had an HbA1c less than 9? And there you are. So I'm going to stop there. So we have type 2 diabetes, how many patients, an indication of are they coming in or not, an indication of are they getting their blood pressure checked and what's the threshold, their comorbid conditions. We don't have to have that, but I threw some in just as a case in point. And then how many are getting an HbA1c and are they at goal. So we can save that and we can call it whatever we'd like. I'll just call it DM2 NCD report. And it says new report added. We can exit that. And now you'll see on our list of available summary reports, we now have a new one, DM2 NCD report. So we can choose our date ranges. I'll stick with the default of the last year, but you could change those dates to whatever suits your needs. And click Run. We have other options in here. You can look at all active patients. You can look at patients with just visits in the time period. And you can also do interesting and useful things like looking at summary reports by provider, by ethnicity, by age group, sex, and other demographic or socio-demographic criteria that you may have specified in the registry. And we'd be glad to work with you on those options also. But we'll just go with all active patients and regardless of provider. We'll go ahead and run that. And here is our little summary report that we just asked for. So we can see we have 2 patients in our little sample data set. All of them have been in this time period from April 12th of 2016 to April 11th of 2017. All have been in at least once. Everybody's had a blood pressure taken. Of those that have, of those 2, both of them have had their last blood pressure within goal, that less than 140/90. Everybody has type 2, of course, because that's what we base the report on. But you can see also both of those patients have hypertension. One of them has hyperlipidemia. And here's the other interesting thing in the report that I wanted us to go further on. One of those patients has had an HbA1c and one has not. So it's that one patient that has not that we can focus on as an actionable piece of information that we can go further in with the registry. So to me, the summary report is really it's a starting point to step further into the data. So you would review this, see what's interesting, see what catches your attention, and then look further to find out more information. So that's the piece that I'll hone in on. I'll go ahead and close that. So we'll jump over to the patient level reporting now. So what we're interested in finding out are patients that have a certain health condition that do not have a certain lab. So that's what this is. List patients with a certain health condition. Oh, I'm sorry, this one. List patients with a certain health condition without a certain lab. You can see when we click that, we had 2 new criteria boxes that pop up here for us to use. So we'd like to look at patients with type 2 diabetes without an HbA1c. So we'll run that, and here's our person. Here's that one person that meets that criteria, and their provider would be listed for you as well. So now we can take that a step further. Within the letters, so we work down the line, right? Summary is listed first, that's what we do first. Patient is listed second, we can do that second. Letters is listed third, that could be our third step. So now we have reminder, letters, and call lists. These are some of the pre-built reports that we've added in. We've built these in simply based on partner feedback, and we can certainly add more letters and lists and so forth as you all let us know that you'd like to have them included. But we can print reminders for HbA1c. We'll go ahead and preview that. And here's our letter. And for every patient that needs that letter, it would be generated. So you could sort of imagine your health center logo here, contact information for your clinic, and a salutations to the patient, that patient's address, and whatever the letter should read for your specific needs, we can make it read that way. Modifying the contents of the letter is fairly easy, and we can show you how to do that and even do it for you. So this says that the date of your last HbA1c is not on our records. So this patient has no indication of an HbA1c. If they did and it was outside of the reporting period, it could say something like, the date of your last HbA1c was on a certain date with a value of certain value. So if there is a lab recorded, it'll also report that back to the patient as well. And that covers the summary patient and letters portion. I wanted to go now to the more complicated reporting. So in the newest version of our reporting tool, which we'll be posting for everybody to have as a download, we have a new report here called Non-Communicable Disease NCD Collaborative Diabetes Measures. So this one is, whenever we ran the creator report, when we used the creator report tool, all of that was based on queries that really build the report on the fly There's a lot of flexibility in those. Those are for more straightforward summary reports. Sometimes, as we were talking about in the slides, however, the summary reports are based on more complex criteria and age distributions, etc., that tool is not well suited for. So in that case, we add hard-coded reports into CDEMS, which is not a big deal, and we're glad to do that with you. So we can run that report on the same 2 patients that we've been looking at in our sample data set. It'll take a few extra moments to run just because it's more complicated. Okay, here we go. So now you can see we have a non-communicable disease NCD collaborative diabetes measures and goals for 2017 report. It gives the clinic that you're running, that's listed, the time period, the date it was generated, and you can see, we'll just step through each of these. We have the number of patients with diabetes in the registry during that reporting period, which is 2. We can see the number and percent of patients with diabetes with 2 or more HbA1c tests at least 91 days apart. The goal being greater than 90%, and NCD had made mention of the typical criteria or threshold just as a reference point, which I think is a great idea. Typically that's less than 25%. But in this case of remember we were dealing with just 2 patients, and one of those 2 patients did have an A1C, the other did not, so we're at 1, so 50%. The average A1C is 7.5. We can see that everybody has a self-management goal recorded during that time period. So those are the consensus core measures. Then we have 3 other sections of the report. We have a cardiac risk reduction, which details diabetes patients 55 or older with a current prescription for an ACE or an ARB. Diabetes patients 40 or older with a current prescription for a statin. Now that's a slight change, but a very important one. For ACEs or ARBs, we're looking at patients 55 or older. For statins, we're wanting 40 or older. That would not be a report that you could build within the Create a Report wizard and do it at the same time. You couldn't include both of those on the same sheet. So that in itself warranted a more hard-coded or more complex approach to the data, and that's what we did. In that cardiac risk reduction section, we also have diabetes patients with their last blood pressure less than 140/90, among those with a blood pressure. We have patients with diabetes with their last LDL less than 100, among those with an LDL. Patients 40 or older with a current prescription for an ASA, and patients with diabetes who are currently smokers, among those with a smoking assessment. So the third section is screening for microvascular complications. In that area, we have patients with a dilated eye exam in the past year, patients with a comprehensive foot exam in the past year, and lastly, diabetes patients with the microalbuminuria screening in the past year. The last section is on prevention screening. So for these diabetes measures, we're looking at patients with a flu vaccine in the past year, with a pneumococcal vaccine in the past 10, with a dental exam in the past year. Oh, in the pneumococcal vaccine, you can see that's looking at a totally different time period than all of the other measures. Generally, we're looking at the past 12 months. In this case, we're looking at the past 10 years. But it's fine to do that with a more layered querying approach in the same report. Dental exam in the past year, depression screening in the past year, and tuberculosis screening in the past year. So this is the kind of reporting that we are glad to do with you. It feels like we're doing a good deed whenever you let us know about the reports that you need, and we can follow through and deliver on those. That's what we're here for. So that concludes all of the basic CDEMS analytics pieces to cover for this learning session. And I do want to iterate that as you have questions, please do not hesitate to call us. My email is abaus@hsc.wvu.edu. It's there on the screen, and we're always glad to hear from you. So thanks very much for your time, and take care.